in high school. My plan A is to graduate high school, take the ASVAB, join the military, go to college and the military to pay for my tuition, earn my bachelor's degree, take the MCAT, apply for medical school, and I want to be an orthopedic surgeon or either a neonatal nurse. I have a plan A and a plan B. I want to attend either Howard, Belmont, FAMU, or MTSU. My future goals are I want to go to all 50 states. I want to be married by 32. I want 4 kids, a big house in the country, and a vacation every year. And um, in college, I want to be a part of D9, be more social, focus on school, make lifelong friendships, find independence and freedom. And where I see myself in 10 years, I hope to see myself thriving, educated, and enjoying life with money in my pockets at all times. Thank you.
Can you guys hear me? So my name is Fatima Rodriguez, and I'm an upcoming senior at Independence Academy. And basically, like when I graduate, I hope to go to college at Arizona State or UTK for nursing or construction management. And then after that, I hope to get a job at probably Vanderbilt or own my own construction site. So my dad could also work there. And then and then I hope to, that goes into my goals, which I hope to travel the world. I hope to live on the countryside with my own ranch and my own horses, and and obviously be around God and have my own pets, my own family, get married, and then have my own cars. Yep.
Good morning. My name is Sananya Wilder Gabriel, and I attend Hillsborough High School, and I'm going to be a resident junior. So after I graduate Hillsborough, I hope to get a medical assisting certification and go into healthcare immediately. I'll also be attending Brown University, the Happy Ivy, and I would also be in the PLME program, which allows you to get into medical school and undergrad at the same time. Then I'll be at Brown's Medical School, and when I graduate medical school, I hope to go into residency and get matched for family medicine because I like the career of going to many specialties. Then after I finish my residency, I hope to establish many clinics for the people who are underrepresented. Thank you.
Hi, my name is Lyndon. I'm currently a student at John Overton High School. Going to be a senior. I plan to attend Alabama A&M, where I'll major in psychology and continue cheering on a college level. My dream is to become a psychologist and graduate with a master's and doctorate so I can have my own practice. After I graduate, I want to live a full life, running my own practice and getting married and starting a family.
Hi, my name is Houston Trevelyan. Um, as far as goals go, college is my #1 priority. Since I'm striving for Ivy League performance, the necessary steps I'll strive to take will be a 30 plus in the ACT, meaningful extracurriculars, and a discipline to commit to it. A little bit about myself. I'm 17 years old. I'm a rising junior. I'm currently homeschooled, and my interests are in electrical engineering, cybersecurity, and medicine. I also eventually want to enlist into the military, which was inspired by my brother who went to the Air Force. So I want to take a bit after him. And yeah, that's about all I got. I'm kind of winging it. I didn't write much. So.
I was so engrossed in those presentations from our high schoolers that I forgot that I was supposed to come up here and be the MC for this event. You all did a fabulous job. Can we give them a round of applause? What a bright future. So now for our ambassadors. As I said to them earlier, be your authentic self, and our high schoolers absolutely were their authentic selves. We will begin with group 2, and then we will go on to group 3. We'll begin with group 1, then we'll go to group 2, group 3, group 4. I know I can't count right now, right? So if group 1 will come on up, I think everything is already saved.
Good morning. I am Madison McNeil, and to the left of me are my group members. I'll let y'all introduce yourself.
I am Gabrielle Maxwell.
I am Blake Bennett.
I am Kendall McGraw.
I am Kenyatta Crawford.
I am Lloyd Morris III.
Hi, I am Jayla Kelly.
As I previously stated, my name is Madison McNeil, and today we will be talking to you guys about oral and systematic health. Okay, what is periodontal disease? Can I get a show of hands of who all is familiar with periodontal disease in the room? Okay, good. All right, so periodontal disease is a chronic inflammatory condition affecting the gums and bone that supports the teeth. Nearly 47.2% of adults aged 30 and older have some form of a periodontal disease. Common causes of it are poor oral hygiene and plaque buildup, smoking tobacco, genetics. So up to 30% of the population may have a genetic predisposition that causes them to have periodontal disease. Chronic diseases. Diabetes triples the risk due to poor wound healing. Hormonal changes, such as pregnancy and menopause, also contribute to it. And certain medications as well. Drugs that reduce saliva contribute to it. Signs and symptoms of periodontal disease include red, swollen, or bleeding gums. These are the first signs of gingivitis. Persistent bad breath, receding gums, loose teeth and pain when chewing, and pus between teeth and gums. Early detection and treatment can prevent tooth loss and risk of systematic disease and further problems.
So continuing on into an overview, periodontal disease typically starts with gingivitis, which is inflammation of the gums, and it is reversible. However, if it's not treated, bacteria can get into deep pockets within the gums, and that just contributes to the periodontal disease, which then can affect and damage the bones of the teeth, the supporting tissues, and that can leave you at risk of tooth loss. And so relating it to pregnancy was kind of our topic. So if periodontal disease advances, there are potential complications for the mother and the baby, which can be preterm birth, low birth weight, and preeclampsia. And so there is a research link between the oral microbiome and then the placental microbiome. So bacteria from the mother can contribute to the placenta and the amniotic fluid, which would negatively affect the baby. So preventing this is just having good oral hygiene practices, regular brushing, flossing, going to checkups, and then if it's continuing and then the periodontal disease advances, you can have deep cleaning through scaling and root planing, antibiotics to eliminate the bacteria, and then extreme cases will need surgical intervention.
Okay, so we've already kind of briefly touched on gingivitis, but I'm going to kind of expand on what it is. So, gingivitis is the first stage under the umbrella of gum disease, and it is characterized by swollen, red, shiny, and sometimes bleeding gums upon probing, tooth sensitivity to temperature, as well as bad breath or halitosis if it's chronic. Gingivitis can be caused by either the complete lack of brushing or oral hygiene or inadequate brushing and oral hygiene. And by either avenue, plaque and tartar are allowed to build up on the teeth, which will or could eventually lead to irritation and infection of the surrounding gum tissue. And then you'll have the the preceding symptoms start to show. Um, yeah, gingivitis can actually go unnoticed in most people, as it is painless and usually does not bleed, but it has the potential to. It has been said before, but yes, gingivitis can be cured. A few methods of curing gingivitis include, but are not limited to, adult prophylaxis, which is essentially just like a teeth cleaning, which is why you should be going every 6 months. Starting and maintaining a good, adequate oral hygiene routine is very important. Brushing your teeth is important, but how you brush your teeth, the foods you eat, all of that, the procedures that are performed on you are only as good as the maintenance and aftercare. And lastly, one could like rinse their mouth with antibacterial mouthwashes or rinses in addition to, well, not in addition, but in together with good oral hygiene. And this just kills disease-causing bacteria. Untreated gingivitis will lead to further periodontal disease, decay of the bone. It will cause your gums to recede as they want to separate away from the bad teeth. And consulting your dentist at the first signs of gingivitis or gum disease, whatever, is always the best, as these symptoms are general and they present differently in different people, and your dentist who knows your history will give you the best plan of action.
So, following gingivitis is periodontitis. What is periodontitis? Periodontitis is an advanced form of period disease, which is a common yet serious oral health condition that has basically progressed past irreversible stages of gingivitis. The stages and grading of periodontitis consist of 4 stages. Stage 1 is a clinical attachment length of 1 to 2 millimeters, which is basically a small loss of the gum or no loss of the tooth. And then stage 2, which is a clinical attachment length of 3 to 4 millimeters, and it has a loss of 4 millimeters due to the probing depth, which is 5 millimeters. And stage 3 is a class attachment length of 5 millimeters and a probing length of 6 millimeters. And then stage 5 would basically, there would be a need for a complex relation for the mobility. As far as treatment, it will include a deep cleaning, which is a SRP, which is a scaling and root planing, and it removes the plaque and tartar below the gum line. If this is ineffective, there will need to be a surgical cleaning to help keep the structure of the tooth.
Hormones associated with maternal oral infections. As you may know, men and women, hormones are different. So men and women are similar in many aspects, but women experience unique health changes at different life stages that requires special attention. One major health factor affecting women is the influence of hormonal changes on both general and oral health. In the oral cavity, hormonal changes primarily impact the gingiva, which is the gums, and the periodontium, which is supporting structures of the teeth. These hormonal shifts can lead to changes in tissue response and inflammation. Hormones can impact an individual's oral health during periods of change, which is the case for hormonal surges that take place in a mother's body during pregnancy, puberty, menopause, and menstruation. Estrogen and progesterone are the 2 key hormones implicated in the material oral infections. These hormones modulate immune responses, promote inflammation, and affect the growth of oral bacteria. Although testosterone is present in smaller amounts in women, it is not a primary hormone associated with maternal oral infections. Some treatments are good hygiene. You can go to your doctor or your dentist on a regular basis, and also take antibiotics. And that's it.
Following that is the pyogenic granuloma. The pyogenic granuloma is a benign, rapidly growing vascular lesion caused by irritation, trauma, or hormonal factors commonly occurring during pregnancy. It frequently affects the oral cavity, particularly the gingiva, and appears as a red bleeding nodule. While it is not infectious or granulomatous, PG involves capillary overgrowth and inflammation. Well, it is primarily clinical, but histopathological analysis is critical to confirm and rule out any malignancies. How do you treat it? The preferred approach is surgical incisions. However, alternative therapies such as laser, ablation, and cryotherapy or topical agents may be considered based on the lesion's location, risk of a reoccurrence. How to avoid reappearance? Well, it's prevented by complete removal and addressing the underlying causes like trauma or poor oral hygiene.
And last but not least, gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy, usually between 24 and 28 weeks. It occurs when the body cannot produce enough insulin to regulate blood sugar effectively, leading to elevated glucose levels. While it often disappears after childbirth, gestational diabetes poses serious long-term health risk. Mothers are at a higher risk of developing type 2 diabetes. Later in life, and their children may face a greater risk of obesity and diabetes as they grow older. Managing gestational diabetes typically involves a combination of healthy eating, regular exercise, and sometimes insulin therapy. But there are more to the story. Recent research has shown that women with gestational diabetes tend to have less diverse gut bacteria and more inflammatory microbiomes in their digestive system. This imbalance may contribute to the insulin resistance, suggesting that the gut health could play a key role as both an early warning sign and a future treatment target. Even more concerning, women with the history of gestational diabetes face an increased risk of cardiovascular diseases, such like stroke. That's why gestational diabetes isn't just a temporary pregnancy condition. It's a signal to prioritize long-term health. Early intervention, lifestyle changes, and regular follow-up care can make a lasting difference for both mother and the child. These are our references. Thank you.
Now I know my numbers. Group 2, social media platforms. Thank you, Group 1.
Greetings, students, parents, faculty, friends, and everyone in between. My name is Jalen Mass. I'm a fourth-year student at Tennessee State University.
Hey, how you doing? My name is Elijah McGowan, and I'm a rising senior at the University of Kansas.
Hello, everyone. My name is Erin Sherman, and I'm a rising junior at Vanderbilt University.
Hello, my name is Elena Crawford, and I'm a rising senior at Fisk University.
Hello all, I am Madison Clayton and I am a rising junior at Tennessee State University.
Hello everyone, my name is Tamaya Franklin. I'm a rising senior at Tennessee State University.
And this is our capstone project entitled Social Media Platforms to Improve Health Outcomes.
To begin, we asked the question of in what ways can social media platforms improve accessibility to health information for underserved populations? Social media is widely used across the healthcare landscape by individuals, professionals, and health organizations. Over 80% of U.S. state health departments actively use social media to communicate health messages, updates, and alerts. Among professionals, 65% of radiologists in the U.S. and Europe use social platforms for health-related purposes, such as professional networking, sharing case studies, or continuing education. Social media helps build community and reduce stigma, providing a space for open discussion and shared experiences, often with the added protection of anonymity, which can encourage participation. It offers direct access to information, including data, research, findings, expert opinions, and real-time updates from both local and global sources. Platforms are also used for rapid alerts during public health emergencies, such as disease outbreaks or environmental hazards, enabling faster responses and awareness.
So how does misinformation, AI-generated content, and online scams on social media platforms interfere with the distribution of accurate health information? Individuals must be careful when retrieving health information from social media, as not all information can be proven safe or reliable. This also relates to the use of AI, as many media apps have incorporated AI assistants, responses, and generated posts into their media. I would like to address a study that acquired data from about 5,000 US adults by examining their susceptibility to misleading health information on social media. Looking at the results of the study, the data summary shows that the majority of individuals found some amount to a substantial amount of health information misleading, as well as difficult to assess. In further detail, young adults are most likely to act on misinformation, and older adults struggle to form an opinion on social media health content. An additional study focused on AI and its role in providing health information to individuals. AI has a wide range of accessibility, it's quick to use, and it has minimal to no cost. However, AI lacks clinical oversight, there is a concern about privacy regarding where information is going to or coming from, and there is a higher chance of users relying too much on AI for answers rather than consulting a doctor. Many steps can be taken to combat the concerns around health misinformation and AI usage on social media. It starts with users going into social media with a careful eye, doing their own research, and relying on their doctor as their #1 source of health information. As AI continues to expand, it's important for AI to have the ability to steer users towards an alternative source, or for AI to incorporate credible information from healthcare providers into their responses.
So we asked, what social media platforms are the most effective at improving health outcomes and why? So we found 4 main platforms that were help in improving health outcomes, which were Twitter, also known as X, Facebook, Instagram, and YouTube. So Twitter is ideally for quick health updates and hashtags on there help spread awareness a bit faster. Facebook help because it has like a strong community aspect, and it's useful for creating support groups, plus sharing personal experiences regarding health. Instagram has more of a visual aspect where there are videos, stories, reels, and posts that spread health information. And influencers and professionals on there also are beneficial to helping spreading that information. YouTube is just simply great for visual learners like myself. There are videos, tutorials, interviews over complex topics regarding health. Thank you.
Sorry.
In order to determine which social media platform is most effective, we found that we needed to take a look at all demographics and different ages, because what platform works for one person and one demographic might not work for another. So as you can see in our data, we have people ranging from very young, and then we have people who are young in spirit but physically older. So we have the people who are the age 29 and younger, They mostly use YouTube, Twitter, and Facebook, with their most trusted platform being YouTube. And as you can see, the trend follows for those who are the ages of 30 to 49, being that the most used platforms are Facebook and YouTube, with the most trusted also being YouTube. And the trend tends to switch once you get around the ages of 50 plus, with the most platforms being used are also Facebook and YouTube, but the most trusted switches to Facebook. And this trend is the same for the people who are the ages of 65 to 74, with the most used Facebook and YouTube, but the most trusted is Facebook. Now, for those in the age ranges of 65 and 74, they use these social media platforms less due to the increased amount of times they visit the doctors and the increased personal connections they have with people like family, friends, and things of that nature.
All right. To answer the question, what social media platform is the most effective from a more general standpoint, we found that about 74% of individuals in the U.S. use YouTube for health-related information, making it one of the leading social media platforms. Three strengths in YouTube is that we found. First off is social media its rich multimedia format, which combines visuals, aids, and narration for breaking down very complex health topics. Next, we found as a strength was wide reach. It provides access to a global audience and the potential for content to go viral. And we also found as a third strength, engagement and retention. Longer formats allow deeper explanation, likely improving viewer retention and understanding.
So given all of the general information that we've reviewed regarding social media and health information, I present the question, in what ways can social media platforms improve accessibility to health information for underserved populations? So the first way I want to approach this question is by addressing the social media's potential to improve health information access. So, social media enables rapid and wide dissemination of health information, especially during crisis. It provides access to health resources, emergency updates, and advisories directly to populations via most likely their cell phone. And it also increases health awareness and preventative behaviors such as higher vaccination rates and adherence to guidelines. Next, I want to address the barriers to social media, because with all great things, there are barriers because we don't live in an ideal world. Unequal access to internet and devices prevents some populations from benefiting from social media, and then lack of a digital literacy for those who have access to the resources but may not know how to use the resources, especially given how technology is constantly changing and the rise of artificial intelligence. So, how can we enhance accessibility through social media? In an ideal world, we would have government policies that treat digital access as a social determinant of health. We'd have infrastructure investments to expand broadband and connectivity in low resource areas. I feel like in 2025, people are failing to realize that strong internet connection is as much as a utility as something like light and water. Just because of the rising trend of using technology to get information and share information, and that is a way that most of us, if not all of us, stay connected. Also offering affordable devices and flexible payment plans to lower cost barriers, and offering digital literacy programs to help people effectively use social media and be able to identify things of misinformation such as like artificial intelligence, deep fakes, and things of that sort. Here are all of our references that we used for our presentation, and then thank you for listening.
Thank you very much, Group 2. Group 3, effects of social determinants of health and overall well-being. As Group 3 comes to the front of the room, I'll just let you see the difference in the size. Come on. Just don't mind me. Y'all never do anyway. Come on, pull it up. Just look at the difference of the size of the last two groups. Group 2 and Group 3. Group 3, you did exactly what was asked of you. Some of the conversation between social media and social determinants of health. This group was much larger than it was, and the charge for Group 2 was to kind of incorporate some of social determinants of health into their topic, and they did just that. So thank you.
Hello, everyone. I am Mia Stevenson, a recent graduate of Tennessee State University.
Good morning, everyone. I am Leah Spruill, a rising senior at Tennessee State University.
Hello, everyone. I'm Kathleen Barlow. I am a non-graduating senior at Tennessee State University.
Good afternoon, everyone. My name is Ryan Sellers. I'm a rising junior at Tennessee State University.
Hi, everyone. I'm Kayla Hamilton, a rising junior at Tennessee State University.
Hello, everyone. My name is Falashawa Viola, and I am a rising sophomore at Fisk University.
Hello, everyone. I'm Lyric Parrish. I'm currently a senior at Tennessee State University.
Hello, everyone. My name is Kagan Wirt, and I'm a rising junior at Tennessee State University.
Hello, everybody. My name is Michael Paul Hammond, and I'm a rising senior at Fisk University.
Good morning. My name is Malachi Booker, and I'm a rising junior at Tennessee State.
Today, Group 3 and I will be presenting to you all the social determinants of health. With our research question, we'll be looking further into how social determinants of health, specifically access to care, systematic racism, and geographic isolation, affects severe maternal morbidity among African American women in rural and micropopulation U.S. communities.
We'll be exploring how key social determinants of health impact Black maternal health with the focus of the unique complications African American mothers face in rural areas versus urban areas. We'll also be examining policies, practice, and community-based strategies that help reduce these disparities.
Our purposes. We hypothesize that African American women who have access to our suggested solutions would have better outcomes than their counterparts who do not.
So for the background info, I devised a timeline of a journey through the social determinants of health. So in the 1960s, social determinants of health were examined with a direct correlation between employment stress and mortality rates in the UK. And then in 1985, the U.S. Department of Health and Human Services established a task force on Black and minority health, which produced the nation's first comprehensive report addressing the health status of minority populations. In 2005, the World Health Organization appointed Sir Michael Marmot to lead a global commission examining how social and economic conditions shape health outcomes. And then in 2007, the commission's report highlighted consistent links between lower socioeconomic status and proper health within and across countries. In 2010, the World Health Organization introduced a framework explaining how upstream factors like policies and governance influence health equity through social hierarchies. And then finally, in 2021, Black Maternal Health Week was officially recognized by the White House.
As far as it pertains to methodology or how we developed our topic, we decided to identify groups that were deeply affected by the social determinants of health, and this includes transportation, access to food, access to health care. We all thought of the African American community, of course, but also the fact that maternal health relates to rural areas. There are maternal wards that are not open anymore in rural areas, and it takes X amount of minutes or even hours to get somewhere to have prenatal and postnatal care. We wanted to make sure that our solutions were feasible and attainable to wherever we are. And the sources and materials that we use, we made sure that we use peer-reviewed research papers and journals. We use PubMed, and the keywords to make sure that we honed in on the topic were social determinants of health, maternal health, rural areas, and African American communities.
Several studies were conducted to explain how much social determinants of health can impact African American and white women differently. Black women, on average, face 1.5 to 2 times the higher risk of severe maternal morbidity. Perceived racism and discrimination. Thank you. Sorry, y'all. Sorry. Perceived racism and discrimination can be linked to increased depression symptoms and affect young African American mothers ranging from 21 to 46 years old. Racism and discrimination are key factors of social determinants of health, and that they can influence both physical and mental health in multiple ways. A study revealed a significant disparity in healthcare experiences. 49% of Black women felt that their concerns were not really heard by their physicians, and only 29% of white women reported the same experience.
Maternal depression is harmful for both the mother and the child. Women experiencing maternal depression are at an increased risk of preterm labor and pregnancy complications. The maternal depression has an impact on the child as well. There's a potential to obstruct fetal development and premature birth, which will reflect into the child's future, including their social skills, physical growth, and academic performance.
So, our data shows that African American women in rural and micropolitan communities experience severe maternal morbidity at 1.5 to 2 times the rate of white women, largely due to limited healthcare access, systemic racism, and geographic isolation. We also found that perceived racism and discrimination, especially against women aged 21 to 46, are strongly linked to increased depression symptoms, which worsen both prenatal and postpartum outcomes. And one of our findings was that 49% of Black women felt that their concerns were being ignored by providers, and this reflects the institutional racism that contributes to poor maternal outcomes and deepens distrust in the healthcare system. Rural Black mothers are more likely to deliver in hospitals with fewer resources and lower safety scores, leading to increased risk of complications and inadequate postpartum care experiences. And lastly, addressing these disparities requires us to expand access to quality maternal care through culturally responsive services, telehealth services, mobile clinics, and mental health support to improve prenatal and postpartum care for underserved Black mothers. Thank you.
So one may ask, how does this all come together? Social determinants such as limited access to healthcare, systemic racism, and geographic isolation significantly increase severe maternal morbidity among African American women in rural and metropolitan areas. Black women face 1.5 to 2 times higher SMM risk, with racism and discrimination worsening mental and physical health outcomes. Nearly half feel ignored by physicians compared to only the 29% of white women. Our findings support the hypothesis Black women with access to targeted community-driven solutions have better outcomes than those without, addressing upstream factors through policy, provider training, and local support is essential to improving Black maternal health equity. The next slide consists of the sources. We have 5 main sources that we all use to come up with this presentation for you all today, and we would like to again thank you for your attention to our slideshow.
Thank you, Group 3. For our last ambassador group, Group 4, they're going to discuss the integration of AI and mission learning in oral and systemic health.
Well, while we are getting set up, I just want to say good morning. Okay, we're still alive? Okay. Well, I just have a question for you guys. Who in here is nervous about the future of AI? Okay. Who in here uses Google? I should see everybody's hands. Because the unfortunate thing about those who are nervous is the fact that AI is going to be integrated into our day-to-day lives. And it is slowly being integrated into healthcare as well. And so though we are nervous, there are some good sides to it and also some improvements. So that is what we have studied. And we are studying the integration of AI into oral and systemic health. I am Chandler Hope.
I am Robert Malone, a rising junior at Tennessee State University.
I'm Andrew Jones, a rising junior at Tennessee State University.
My name is William Simpson. I am a rising sophomore at Belmont University.
I'm Deshaun Pugh, a rising junior at Tennessee State University.
So our research question was, how does the diagnostic accuracy, patient communication effectiveness, and clinical decision-making of human physicians compared to AI-assisted systems and in AI practices?
So the hypothesis we came up with was that in clinical practice, human physicians would demonstrate superior performance compared to AI-assisted systems in terms of diagnostic accuracy, effectiveness of patient communication, and quality of clinical decision-making.
Now, the goals for this experiment was to compare the diagnostic accuracy between physicians and AI systems, evaluate the patient communication effectiveness between human physicians and AI, analyze the clinical decision-making processes of the doctor versus AI, review current trends and future projections of AI in healthcare, identify key limitations and ethical concerns of AI in medicine, and last but not least, propose a couple recommendations for the future of AI in healthcare.
So the background information is that we're using AI systems are increasingly used in clinical diagnosis and decision-making, and tools like Dentellligence, MedGPT, and more are used to analyze imaging and records to assist doctors. It can also be fast and data-driven, but lacks the human empathy and content, and an accurate diagnosis often requires understanding medical history and rare conditions. AI may misdiagnose or overlook surgical needs in complex cases, and human doctors remain critical in high-stakes clinical decisions.
This is our methodology, or how we got to our end goal. So first we selected a case study for an 80-year-old woman. She had something wrong with her jaw, something called osteocrosis. I'm not sure if you guys are familiar with it. And so we all took the same clinical and we put it into different AI, like chatbots. And then we collected the information that each AI bot gave us and put it into graphs to compare them to each other to see how accurate it was to the original case study. The AI that I used is called Nova AI. So with this case study, it showed that The first was the trigger event. It gave something different. It gave something more specific than the original case study. So the AI gave it more detailed, and it also gave an extra diagnosis of something wrong with the nerves in the mouth. And then with the reimplantation of the tooth, it said that it should be reimplanted.
Next, for my AI, I use ChatGPT, and the earliest difference I saw was that in the medical history, it brought up macular degeneration, which wasn't mentioned in the human clinician report, as well as the trigger event. It says it was probably caused by post-implant pain and exposed bone rather than just the bone exposure. And the diagnosis was what I found really intriguing, as the human clinician said that MRO&J was the primary diagnosis, but the AI bot said that chronic osteomyelitis was most likely the primary diagnosis. And then in terms of the reimplantation advice, which wasn't discussed in the human clinician, ChatGPT said that it should avoid implants in posterior mandible. And that kind of gave me the takeaway that AI, though it can get some things right, I see it more as like a helpful matter, as when it comes to the human clinician, it might have just forgot to mention the reimplantation advice, where ChatGPT, it's going to know that that might be a key detail, so it's going to make sure it hits that point.
The chatbot that I used was DeepSeek, and then the diagnosis, it was also different. And so instead of the MRO&J, it diagnosed the osteomyelitis. And then for surgery, instead of removing like the mandible and for the lower jaw, like what the clinician said, it only recommended a graft. And then the bone meds, it recommended a shorter use of the medicine and different medications. And then for communication, for DeepSeek, it was more friendly, so it was more digestible for the patient, whereas for the clinician, it was kind of hard to digest, and it wasn't very clear actually to what the problem was.
All right, my AI chatbot was Dentelligence, and it is an AI created for dental physicians as well as dental students to just help them with clinical questions. The first thing right off the bat that I noticed was the primary diagnosis was completely different. It was MRO&J, and for the AI, it said that the diagnosis was peri-implantitis, which was completely different. It also mentioned a different cause of the condition, as well as the surgical plan and the follow-up outcome. As Robert said, the AI, it will hit sort of around the point, but it never hits it head on like the human clinician, so I would take the human clinician side of things in this case.
So for mine is a little different. I didn't use a different chat bot. I used a different chat add-on onto ChatGPT called MedGPT. I didn't know you could use chat add-ons until recently, about a month ago. These things are more specified than general ChatGPT. ChatGPT is like a jack of all trades. This is more for the medical side. The main thing that I saw different between my chatbot is that while we talked about human compassion being different, I feel like my chatbot tried to emulate human compassion in a certain way. As in terms of the rehabilitation, it didn't really say how the human condition really, as you could say, went straight to grafting. My chatbot more so beat around the bush and had a longer route of 12-month rehabilitation versus the human condition 6-month. And also the intensity of the treatment was way less than what the human condition would do. I think that is a way of MedGPT or ChatGPT trying to emulate human emotions, even though it's unconscious. I think that's a thing that you're trying to emulate that you're trying to emulate having a human emotion is also a good thing and a bad thing, as in terms of, I think this also, loving is also like letting go. I think the human condition did that really well, trying to get straight to the point, but my chatbot did not do that. And I think that the longer that you try to draw out the follow-up outcome might not be the best thing that's happening for the patient. So in terms of the discussions, because I had the last chatbot, we talked about the AI-assisted systems show limitation diagnosing complex severe conditions like medication-related osteochondrosis of the jaw. AI failed to incorporate critical factors such as medication history and need for surgical intervention. Human physicians demonstrated diagnostic accuracy and holistic patient evaluation. Clinical decision-making and communication still rely heavily on human judgment. Results support the hypothesis that human doctors outperform AI in complex cases, and AI may serve as best supplementary tool, but not as replacement in clinical practices.
For what's to be expected, AI models are used to detect cancers and fractures like pretty accurately, and so and it's optimizing administrative tasks to so doing a lot of stuff that the doctor will get burned out doing, like putting it in the charts and whatnot. And they've also successfully done procedures like gallbladder removal under supervision, and emerging standards emphasize combining AI with what we're already doing and physician judgment to reduce bias and maintain trust. And AI will soon integrate genomics and wearable data and, to create fully personalized treatment plans.
Now, though we are nervous integrating AI into our healthcare field, I do believe that it's something that is coming. And so with that, the only way to make it better is to balance AI and human expertise, ensuring that that trust is still built between the patient and the doctor. So with doing that, AI should just support, not replace clinical judgment, empathy, and patient rapport. We should continue to have that relationship with the doctors, have that one-on-one conversation face-to-face with the doctors versus just giving it all to AI. Regulations must define transparency, accountability, and patient data protection, which is a real big thing integrating such a thing as AI. It can definitely go south with HIPAA violations if not done correctly. So just ensuring that everything is encrypted when doing so. And last but not least, future healthcare providers must understand how AI works, when to trust it, spot its errors, and clearly explain the role to patients, making sure that patients understand the role that's being taken place with AI in healthcare.
So in conclusion, AI is highly effective in diagnostics, data analytics, and enhancing clinical efficiency, but AI will never be able to replace human empathy, ethical reasoning, and case-specific decision-making. Patient care is not one size fits all, and it changes every patient a doctor may see, and AI, it's always going to give you that general report. And the ideal approach would, as Chandler stated, would be using AI as a supportive tool, as autopilot can get us 90% of the way there, but that 10% will always be where you need that doctor to step in because they've been trained to do the job. And these are our sources.
Thank you.
With about 20 minutes left, I can say good morning. It is so wonderful to see everyone here today. I am Dr. Sheree Farmer. I am Dean of the School of Dentistry. And let me say to the parents, to the families, thank you so much for giving us the opportunity to, whether it was your loved one who's in high school or college, or even our ambassadors program, having the opportunity to make a difference, make an impact, has also been an impact not only to me, but to all of us. At this time, before I forget, Dr. Tynes and others that have worked tirelessly with the programs, with our 3 programs, will you all please stand? I want to acknowledge you all. Ms. Mack, you can just wave your hand. A lot of work goes into planning. This doesn't happen by accident. And a lot of meetings, a lot of phone calls, a lot of preparation. And so I want to take this opportunity to thank everyone who helped to make these programs possible. When I look around this room, you all are the future. As I sat there, to me, and I've said with the team that I work with, that this is really kind of a full circle moment. It was in high school that I had the opportunity of being in an HCOP program. And while in that program, decided that I wanted to be a dentist, not thinking that I was going to be in education, but after practicing, having the opportunity to be here and to now be directing an HCOP program is really a full circle. And so I do want to say to whether you're in high school or college particularly, you all are the future, and you saw some of the inaccuracies with AI. AI is great, and it helps us with a lot of things, but it cannot replace the touch and feel of knowing what's going on with your health. And unless they create a Dr. AI that I can touch and I can see their degree and know that they came from school, let's still continue to. There's still going to be physicians and dentists and public health advocates that are going to be needing that. It's nothing like the real thing, as I say. To our older adults, veterans, it is never too late to decide to do something different, to learn more. We talk about lifelong learning and the importance of that. And certainly in this day and time, as we, with ChatGPT and with technology and all of the advances, it's important for us to stay abreast. We don't have to be on the cutting edge, but we do have to have the knowledge and the expertise. And so I applaud you for continuing lifelong learning and using opportunities to learn and grow and continue to better yourselves. We have certificates for everyone, and that's the time we've all been waiting for. So at this time, we will have the certificates. Are you going to call the?
Thank you, Dean Farmer. We are going to go in the order of the back of your program. And the dean is going to graciously help us. We're going to start with our high schoolers, and as I call your name, if you would come forward, you will pause and take a photo with the dean as she gives you your certificate. Quudus Balu. Abriana Collins. Shakila Eubanks. Naya Eder. Madison Lane. Jackson Law. Sophia Mebs. Jakiria Miller. London Neighbors. Fatima Rodriguez. Houston Trevelyan. Sananya Jabrilian. Walda Gabriel. That concludes our high schoolers. Now for our ambassadors. Fulsewa Abiola. Kathleen Barlow. Lloyd Barnes III. Blake Bennett. Malachi Booker. That's Malachi. That's Malachi. Madison Clayton. Alana Crawford. Elena Crawford. She corrected me this morning. Elena Crawford. Kenyatta Crawford Jr. Tamia Franklin. Tamaya Franklin. Kayla Hamilton. Michael Hammond. Chandler Hollis. Chandler Holt. Andrew Jones. Jayla Kelly. Robert Malone. Jalen Mask. Gabrielle Maxwell. Elijah McGowan. Kendall McGraw. Madison McNeil. Lyric Parrish. Deshaun Pugh. Ryan Sellers. Arian Sherman. William Simpson. Laye Spruill. They've been working on me for 6 weeks. I finally got something right. Love it when your student compliments you. Mia Stevenson. Oh, I got another clap. You see them? They're shout out. I got it right. And last but not least, Kagan Word. That concludes our ambassadors. Now to our adult, veteran, and non-traditional students. First, we have Mutiana Cantrell. Darianta Edens. Rico Frierson. Brianna Johnson. Sharice Marshall. Rose McGavick. Ivory Oliver. Courtney Patterson. Valencia Petty Perry. Tracy Roberts. Pure Simpson. Destiny Whaley. Marsha Willis. Marcia, I apologize. Marcia Willis. And last but not least, Tiffany Yarbrough. We have closing remarks from one representative from each program, and then we will move to our luncheon. So if we would have Arian Sherman from our ambassador program, Tracy Roberts from our adult program, and Sanyanya. I've got a second opportunity to redeem myself. Sanyanya Wolda Gabrielle, come and give us closing remarks from each program.
Hello once again. My name is Erin Sherman, and I'm a rising junior at Vanderbilt University, where I'm majoring in medicine, health, and society. I am a pre-dental student, and I hope to attend dental school directly after my senior year. I am very grateful for this program, as I am officially taking the dental admissions test in 24 days. The community of students, student doctors, and professors, the science courses and perceptual ability session for pre-dental students, and the capstone project have really expanded my knowledge and helped me reinforce my understandings of all things science. With this program, I definitely feel more prepared for my upcoming exam, but I also feel extremely prepared for the road ahead. Beyond science, I have learned a lot about the financial obstacles that come with pursuing medicine. And while those numbers are scary, and the idea of being an adult with bills while also trying to receive education is scary, I know that in the end, I get to learn how to help others, and that's all I want to do. I also struggle immensely with test anxiety, so learning about testing strategies, study skills, mental stamina, and ways to manage stress has truly been insightful for me. I've met some wonderful people in this program, and being here has only enhanced my passion to be a dentist, serve the community, and help improve health for all individuals. This summer, I've had to commute from Detroit every single weekend to be here in person, and I thank Dr. Gray for giving me grace with that. So while I never want to travel again, I feel so blessed and lucky that I've been able to do that and have this amazing opportunity here at Meharry. In the end, the travel was 100% worth it, and I'm truly excited to see how my future will unfold. I know that my participation and the connections I've made in this program will only add to my journey. Thank you.
Good afternoon, everyone. I'm Tracy Roberts. I would like to welcome you to the Health Career Opportunity Program, a special initiative offered by the Meharry College to support non-traditional adults and veterans. The program is designed to guide and empower the individual who are interested in pursuing a career in healthcare industry. Over the past 6 weeks, we have had a privilege to meet with professionals from various areas of healthcare who have helped us understand the steps we need to take to reach that important career and get this job and interview. For me personally, being a part of this program has deepened my appreciation for what Meharry stands for in our community. When I first moved to Nashville, I came to Meharry for all my dental care. Yes. They did an outstanding job and have gone over and beyond with this program. I have experienced an even greater level of support and dedication for Meharry and their team. To my fellow classmates, take everything we have learned, put in action, and know that we cannot fail. We are prepared, we are capable, and we are worthy of this success. I finally want to extend a heartfelt thank you to Dr. Sykes-Smith, Dr. Cole, Dr. Alexander, Dr. Lavelle, Mr. Byer, Ms. Ball, Ms. Pratt, Ms. Thompson, and Ms. Stewart, who have given their time, their evenings and Saturdays to help us on this journey. Whether we're returning to the workforce or just beginning our path in healthcare, your commitment has made an everlasting impact, and I do appreciate you. Thank you.
Good afternoon. I won't take your time because I know you guys want to eat. But I'm Sanania Wilder Gabriel, and I'm one of the participants of the High School 8SCOP program. This program provided us with ACT prep, general chemistry and biology classes, and college tours. When I first took the pre-ACT, it was the second semester of my sophomore year, and I remember feeling anxious, stressed, and worried. However, when I took the ACT this July, I had confidence, I had good pacing, and I had so many differences that I didn't achieve during the pre-ACT. This is thanks to the ACT teachers and supervisors who have helped me and my peers throughout the 6 weeks. My favorite experiences in this program was the visit to the School of Dentistry and the stimulation lab, where we learned CPR and also how to make a model of teeth. Thank you to all the individuals in Meharry who helped me and my peers throughout this 6 weeks. It was an amazing experience. Thank you again.
Thank you again, everyone. Let's give all of our participants a round of applause. We are so proud of you. We're going to allow them to eat first since they're our honorees. We will dismiss them, I guess, by table first, and then we will dismiss you by table. We will serve you all. We will start, I guess, with our adults who are right here, and then we will shift to our next table. So let's do these 2 tables first, and you can go ahead back there, and we'll just dismiss you going this way. Oh, I'm sorry, our high schoolers are over here. I'm sorry, our adults are our high schoolers and our adults. So 3 tables at a time, so come on. I'm just doing this first row. Miss Smith, I see our high schoolers right there. I didn't want